Hey folks, this is another Bariatric Bits with Dr. A. So let's focus now on what to expect before, immediately after, and long term. I'm going to get the two either ends of this out faster. So what to expect immediately before surgery and after in the long term. Before the surgery, essentially I'm going to tell you, follow up with my bariatrician, Miss Jenny, in my office, and she'll tell you what you need to do. And I'll have another section on this. In the long run, we really need to make sure we do a couple of things. We get your exercise and also make sure that you're on your multivitamins and all your vitamin levels are within appropriate levels. So let's move to the crux of things, because this is very common. So you had surgery. What to expect exactly? On the day of surgery, you're obviously going to come in, you will have a drink, and that drink is to expedite your recovery. You're also going to have some medication. Once again, this is called enhanced surgical recovery. So you'll take these medications, and the whole goal of this is to decrease the nausea, decrease the vomiting. While it's not unusual to have some nausea and vomiting immediately after surgery, remember you had anesthesia, you had surgery, if you had sleeve, bypass, duodenal switch, there were still changes to your stomach. So your body's trying to still figure out what happened, and as it gets rid of anesthesia, that nausea gets better. So how do we do this surgery? Because we inflate the abdomen with an inert gas, a CO2 gas, that goes away. Everybody says it, I have gas pains. So what are the symptoms of gas pain, or how do people have gas pain, and what do they experience? It really is variable from person to person. Many people have had some kind of surgery in the past, and it's similar, to that experience before, which is usually shoulder pain or even neck pain. So it can start anywhere from the base of your neck to between the shoulder blades. It's a strange heaviness feeling. If you had a hiatal hernia at the same time and that required for it to be fixed, you're going to have a little bit more of that sensation, because that's called referred pain. So even though your hiatal hernia is lower down in the abdomen, because of where the diaphragm starts embryologically, you will get the referred pain actually between your shoulder blades. So you kind of, despite moving, and people think, was I in an awkward position? Was I not protected? All of these precautions were taken, but because of your surgery, you're having the feeling. How to get rid of it? The medication can help. The number one thing is to get up and walk around as much as you can and get rid of all that gas or gas remnant. Even though we empty and get rid of all the gas immediately after surgery, some people still have a little bit of irritation. That does go away in 3 to 5 days time, and it gets much, much better because the body just recovers fast from it. Now, almost all, if not 99.9% of our cases are done through very small incisions, either robotic or laparoscopic. So you can have several small incisions. What kind of discomfort and pain are you going to experience? Again, it depends on your genetics, okay? People say have high or low pain thresholds. That's a subjective thing. However, you will feel as if you have done 100 to 200 crunches the day before. That's kind of soreness that you're going to feel. If you do so, what we tell you is don't do any heavy lifting. More than the heavy lifting is no sudden movement. For example, you got pets, make sure the pet doesn't jump on you. You're not going to undo anything. It's going to be sore. If you've had sleeve done or the duodenal switch, one of the incisions is a little bit larger than the other one. Still is a size of the tip of my thumb, but because we put a dissolvable suture on the inside, you're going to feel a little bit of a tug, for example. Generally tends to be on the right side, and you're going to have a little tug there, and it's not necessarily at the side of the incision, it could be even a little bit lower. So if you have this, rest assured, this is nothing that you need to worry about. It will go away. This is surgical pain, as in musculoskeletal pain. Put some ice pack on it, 10 to 15 minutes, alternate with warm packs, sometimes that helps, and do that 2 to 3 times a day. That's after you leave the hospital. We will make sure that you get some pain medication as well, which is liquid pain medication. You're going to have nausea medication. Again, not unusual to have some nausea, and that will go away over a period of time. And you're also going to have antacid medication. Generally, the antacid medication is for healing more than the actual antacid symptoms themselves. So, one more thing. You're going to notice that immediately after surgery, you will almost sense water, liquid, or food slowly go down. Remember, your stomach is actually high up. The entrance of the stomach is about here, just behind the bottom part of the breastbone. So it's really high up. you will feel food slowly going down there. That's the importance of us giving you a small cup and telling you to sip slowly on that. If you gulp, you will know you did that too fast, because you're gonna feel a pressure, discomfort at this part of the stomach. Again, this is just, it's exactly as if you say, for example, had a bruised muscle. That's why you get put in a splint. You want to take it easy. You want to let that organ recover. And the stomach is very resilient. It has an excellent blood flow, and so it recovers very fast, but you just have to give it a couple of weeks to recover. Those are the main things to expect immediately after surgery. With regards to your multivitamins, you start those 3 to 4 weeks afterwards. There is no rush in starting the multivitamins. It is very important that you start them about 2 to 3 weeks afterwards, but the number one reason for that is we want to make sure you are staying well hydrated. As long as you are well hydrated and you're able to drink water, and remember, we will give you 64 ounces. That's a very high goal. Most of my patients cannot hit that number, but we have to give you a high number, because we all know if we gave you 50, you're going to do 40. So we give you 60 so you can at least do 50. Until next time, remember folks, we have one life. There is one body which we can control. So let's do that. And we've got one chance. So let's make the most of it.